Reports now the FDA is expected to announce a new warning for the Johnson & Johnson coronavirus vaccine after detecting a small possible risk of a rare side effect.
It comes as Pfizer says a third coronavirus booster shot may be needed, but health officials remain unconvinced. Here's CBS 13's Natalie Brandt.
The FDA and CDC are monitoring reports indicating a small possible risk for a rare condition known as Guillen-Barre syndrome associated with the Johnson & Johnson COVID-19 vaccine. The CDC has detected about 100 preliminary reports of the condition in which the immune system attacks the nerves out of the more than 12.8 million people who received the J&J shot. The cases were reported about 2 weeks after vaccination, mostly in men over 50. No link has been found between Guillen-Barre and the Pfizer and Moderna vaccines. This comes as Pfizer is presenting data to U.S. health officials, which it says shows fully vaccinated Americans may need a COVID-19 booster shot.
We welcome their data as a part of that assessment, but we'll make the CDC and the FDA will make a recommendation based on their own assessment.
The concern remains for those who are not yet fully vaccinated, as the number of new coronavirus cases is once again on the rise in the U.S. Over the past week, new cases are up by 66%, and infection rates are rising in more than 36 states.
We're concerned about those regions of the country, those states, those areas, those cities in which the level of vaccination is really quite low, hovering around 30% or so.
Researchers at Georgetown University found 5 under-vaccinated regions, which they say could lead to new virus mutations capable of defeating current vaccines, putting the entire nation at risk.
Well, a study published in the journal Nature suggests that having only one dose of a vaccine offers little protection against the Delta variant. There are 25 million people in the U.S. who have received only one shot and 140 million who are unvaccinated.